those abdominal muscles are stretching so much that they are stretching up to 115% of what their original length was before pregnancy to give room for that baby growing. For different reasons, you can have that connective tissue start to thin. And then as it thins and stretches, you start to get more what I guess what you would call a hole in it. This is where you're now having your diastasis recti. Welcome back, ladies, and to others who may be looking on as well, hoping that you get some good information on this series coming up. So there's a bit of a buzzword going around, and everybody's kind of looking at it with a panic and not sure what's going on, right? Big word, diastasis or diastasis, however you say it. In the clinical world, we'd probably say diastasis recti abdominis. Yes. Now, what does that mean in layman's terms? Well, we're talking about abnormal separation of the abdominal muscles along the midline, but not affecting the fascia. Yeah, still a little bit highfalutin words, right? So think about your six-pack muscles. We're talking about the ones that come right down the center. And it is attaching right under your breastbone and all the way down to your pubic bone, right at the bottom. So we take up the entire stomach portion, right? Now, just like you have a left arm and a right arm, you're going to have left rectus abdominis muscle, right rectus abdominis muscle. They're connecting top and bottom to bone, but they connect to each other in the middle by what's called a linea alba. Now, that linea alba is a structure that's made of connective tissue, and that connective tissue is what keeps, to some extent, the integrity of that area. It keeps it together. For different reasons, you can have that connective tissue start to thin. And then as it thins and stretches, you start to get more what I guess what you would call a hole in it. This is where you're now having your diastasis recti. Back to this diastasis. I say diastasis. It just comes out of my mouth that way. Now, it is not a hernia, but research done by the German Hernia Society and the International Endohernia Society has found that having the diastasis increases the chances of you getting a hernia. And we're not just talking about right around the belly button or the umbilicus. We're talking about hernias even up under the breastbone or the ones that come down into your groin. So we know that there's almost like a correlation between the two, not necessarily a causative effect. And there's a difference, meaning this one doesn't automatically lead to that, but they seem to kind of go together. Now, one of the things that happens when you have that hole separate is that instead of those muscles now connecting and when they provide their force coming straight up and down, they start to kind of curve around and make that opening more large to some extent. So think about suspenders on an obese man, right? You get that that image of it coming and opening apart and leaving the center kind of fully open and available. And what is the prevalence of diastasis? It is up to 57% in the population. Now, notice I said in the population. We're not talking about just women. We're also talking about men. The word diastasis has been thrown around a lot in the world of pregnancy because when they do research, most of the people, most of the participants that they're looking at tend to be women who are pregnant or postpartum. You almost hear it as if these are the only ones that can experience it, or these are the only ones that can have it, but it's not necessarily the case. Some of the risk factors that are known and are considered almost a consensus, like most of the research will say the same thing. Pregnancy, postpartum, and obesity. These are three things that is almost for sure we know that it can be a risk factor for having a diastasis. Now, there are other things that are floated around in different studies, but there's no scholarly consensus. What do I mean by that? There is no agreement across the board with multiple people finding the same information. So that means maybe there's a risk, maybe not. But these are some of the things that we can think about. And these are some of the things that probably require a little bit more research with a greater population, including men and including ages from, childhood to 90s or however old. So in some cases, there are some researchers that are finding that race may play a role as a risk factor. Some are saying that the connective tissue density that is common in African Americans can play a role in having increased chances of a diastasis. However, other researchers are finding that being Caucasian female puts you at a higher risk. So there is no one consensus on that. Another one of these things that talks about, another one of the factors that comes into play is age. Now, some of the researchers saying that the older you are, the chances are that it happens to you. But I'm not sure that they checked these people when they were younger to see whether or not it happened older or if it happened in their young days and never resolved. Because anecdotally, this is something that I've seen, and this is something you can see, that it can continue through the lifespan if not addressed. One of the things that I think to make it even more of a question is the fact that if it's happening in a pregnant population, that tends to be a younger population. Those are our fertile years, the years when we're having babies more. We're not looking at people having babies that often in their 70s. We know it's happened, but it's not a popular thing. And another one of the risk factors that was talked about, but still no consensus once again, was diabetes. So the presence of having a diabetes diagnosis. Some of the researchers are finding that that became a risk factor, and others are saying that it's not necessarily so. So just to put it back in plain words, we're looking at the pregnant population, we're looking at the postpartum population, and we're looking at the obese population. For the pregnant population specifically, what we want to think about is not just that you are pregnant, that's a risk factor, but the more pregnancies you've had, the more babies you carry. Those are some of the things that are going to increase your risk of developing a diastasis. But like I said, it can happen in women who are non-pregnant, and this is something that showed up in the research as well. As I mentioned even earlier, there is a bit of a bias when it comes to the research because it's being consistently observed, or it's been consistently researched in one particular population. So there needs to be more information before we can say, yes, this is the people that get it and these are the people that don't get it. The next part of the question would be, well, why does that even happen? Why do we get this diastasis? We know who can get it, we know what it is, but why does it even happen? And so the belief is that it is an increase in the intra-abdominal pressure, right? And I know that probably makes the most amount of sense when you think, oh, pregnant. The women are getting larger and the muscles have to stretch and move out of the way to give that baby room to grow. And one of the things that was found in the literature is that those abdominal muscles are stretching so much that they are stretching up to 115% of what their original length was before pregnancy to give room for that baby growing. So let's think about it. That tissue keeps stretching, 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 stretching. We now start to have that separation. So it is physiologically a natural thing that happens in pregnancy. It is not this abnormal, panicky, oh my goodness, I cannot believe that I'm having this and all of that. It is something that may happen. Doesn't mean it always happens and it will happen, but it can happen and it popularly does happen, commonly does happen. Considering that most of the information is being gathered on the pregnant population, they did have some information on the obese population or the population that is experiencing obesity. And what's known about this is that with the increase in the abdomen size, you have an increase in the pressure with the contents of the abdomen, especially if there's extra fat in there. It puts a lot of pressure on the walls of the abdomen. And that's one of the other areas where you can get some of that thinning of that linea alba because of that pressure that it's feeling. So, okay, we've talked about it. We talk about who can get it. We talk about the risk factors. Well, how do you know if you have it? Now, to be honest, symptomatically or in terms of how you feel might be one of the best ways to go about looking for it, right? People who have a diastasis can sometimes have an increase in low back pain. Sometimes they have an increase in pelvic floor dysfunction. Sometimes they're having increase in just pain within the abdomen. It's hard for them to lift and do things. But if we're looking at how we're going to clinically assess it, there are many ways to check for it. You can use calipers, which are tools that are used to measure distance. Most researchers would have that. You can use a CT scan. However, that's a lot of radiation for something that's really not life-threatening. But ultrasound seems to be one of the popular ways that it's being diagnosed at this point in time. And probably in the research world, that works well. A tape measure also works well to use. And my favorite method, the fingers. Why is it we would use the fingers? Because we generally most have them as practitioners and clinicians. And though we don't all have the same size, we have a general estimation as to what we're looking for. So what I would tell you that I learned as a physical therapist, from physical therapists who've been doing it for years, you're looking at anything greater than 2-finger distance in between, right? How we look at it as therapists is also the width of the fingers and the depth of how deep it goes. Now, the same group, meaning the International Endohernia Society, the German Hernia Society, in their expert conference, where they have all these experts in hernia from around the world, when they had their meeting, this is in the early 2020s, I believe it could have been as early as 2021 or 22. With their research, with their conference, they came together and gave a guideline, a general guideline as to what constitutes as a diastasis or not. And so we're looking at that definition here on out. The consensus from the experts was that if it's less than 2 centimeters in distance between those two muscles, right down the center, that is physiological. And what that means is that it is normal. It's something that you can find in a normal population, not an issue. If it's greater than 2, but it's less than 3, it's considered a mild diastasis. If it's between 3 and 5 centimeters, moderate. And if it's greater than 5 centimeters, it's severe. Now, I don't have my measuring stick, but I can tell you, I looked at the 2 centimeters and it is definitely less than my 2 fingers. So it goes back to stand where less than 2 centimeters is normal. And if we start going to 3 or 4, we start to get wider and wider that way, then we're looking at more of a true diastasis. Now, like I said, looking at finger width and depth going from end to end. So at the belly button, going left to right versus top to bottom. How would you do this testing for yourself? Because you can check for yourself. If you were to lay on your back with your knees bent and in that position, start at the very top, right under your breastbone. And so you're going to be moving down, all the way down towards your pubic bone. That's your start. However, in that position, you just bring your head and neck up off the table a little bit, and you just poke going down your belly. You can start to feel whether it's tight and together or whether there's spots where it feels like it starts to have a little dip or a little bit of a hole. That is how you can measure to see where you are. Now, if you've measured and you found you're right around 2-3 fingers, and you feel like, man, yeah, I've been dealing with some back pain and, oh, I've been having some other issues, then it might be a reason to see someone. If you're not really having symptoms, there's really not a reason to worry about it at that point in time. The question for many people is it preventable? Can I do something to stop myself from having this diastasis? And in general, I would say probably not in many cases. If we're looking at a population of obesity, managing weight would be the helpful thing there. In pregnancy, not so much. We're not looking at absolutely stopping it from happening. We're looking at managing how severe it can get, and then working on figuring out the ways of bringing it back and getting more stability within the trunk. And I say it that way because it is an aesthetic thing. It can cause you to have a bit more of a pooch or pouch in the front. But as a physical therapist, I'm also going to be looking at how it affects you with your function. How are you able to pick up the things you need to pick up, whether it's that child or at work and you're having to pick up that 30-pound bucket. But we're going to want to look at how you're doing functionally and how we can help you get back to a more normal way of moving and feeling. Now, studies have shown that doing exercises while you are pregnant can have an effect on the diastasis. It does not stop it, like I said, but it can make the severity of it less. And these were studies that were performed just in 2022. Now, let's imagine, okay, whether it is that you've had a baby or not, it's been 5 years, 10 years or not, but you've discovered that you have a diastasis. You're recognizing, ooh, back pain has been a thing. What is it that you can do? What is it that you should do? So of note, for those moms, those new moms, early moms, the research has shown that within a week to 8 weeks postpartum, you can have spontaneous resolution of that diastasis. But in some cases, it can persist up to a year or even years later. This is probably the point in time where you'd probably look out for some help, look to see if you can do something about it. One of the major and important things that we would want to do is get you physically active and moving, yes, but making sure that those muscles are continuing to pull in an appropriate way. Think about it this way. If these are what your muscles are looking like, right? Normally, so this is where your belly button would be, right in the center, and this would be your muscles at the top and the bottom, left and right. If you have the diastasis now and it's starting to look like that, and you're going in to do exercises where you're engaging those muscles, the desire would be that they would engage and stay right there. But more than likely what happens is they start to engage and they widen as they tighten and shorten. So we have to do things to make sure that we can get those muscles to line up and work better so they can provide the force the right way and give you the stability. Some of the other things that need to be done is addressing how we're breathing to make sure that we're not putting increased pressure into that abdomen. But, it's important that you seek someone to get help with this. So, of course, I'm always going to recommend that you see someone professionally, and a pelvic floor physical therapist is precisely someone that you can see to help you with some of these issues. For those who may not be ready for that, who feel like they're, whatever the reason, there are some resources that you can find online. And there are different people who have been in that therapy world and have put out exercises that can help even from week one. And in particular, there is the Sarman exercises. And if you look them up as that, Sarman diastasis exercises, you will get an idea as to how you start. Once again, she starts off with the breathing and then doing little work with the legs and things like that. It is important that you see someone for it if you're having problems. Now, what kind of problems? Like I said, back pain, difficulty with lifting and carrying. Sometimes just holding that baby can be such a strain that it feels like it's so much work there. But it's important to do these things because those abdominal wall muscles, they're not just for looking good with that six pack. they're very important in keeping the stability in the trunk. They're very important in helping with our breathing mechanics. They're very important in just keeping the ability to move and use our body in good ways, our posture. All of these things become important. And so it's important that we not think of this diastasis as a death sentence, that we not think of it as something that could be so very detrimental, but we do know that it can affect the quality of life. And so wherever you are in that journey, seek the help. There can be help found. And folks, this information that was given is not medical advice. It is purely educational. And I would recommend that you see your healthcare providers to find information and referrals that are going to be specific to your particular needs. This is to help you be prepared as you go to speak to your providers. Once again, I'm Trisa Job, Doctor of Physical Therapy, representing Healthy Bump Club. If you want to follow me for more information, I'm on Instagram at trisajob.dpt.